artificial intelligence is the same as machine intelligence. So it can be anything where machines demonstrate cognitive functions such as humans associate with the human mind, such as learning and problem solving.
There are two main types of machine learning that we're looking into at Dr. Foster, and these are supervised and unsupervised machine learning. In supervised machine learning, we're generally interested in predicting a particular outcome of interest, for example, an emergency admission, a fall, or a complication. And we want to understand the various factors that are influencing this outcome and predict it. In unsupervised machine learning, we don't have a particular outcome that we're interested in, but we really want to understand the data, understand patterns in the data and the complex relationships between variables.
So we're using it to cluster groups of patients using machine learning clustering techniques, and we're also using machine learning for predictive analytics, predicting potentially avoidable events such as emergency admissions, falls and mental health crises. We've built a model for Bradford which looks at identifying people that are at risk of emergency admissions, and we're just in the process of implementing that in Lambeth. We'll be moving on to predict falls for them for their elderly and frail patients.
The Dr. Foster unit at Imperial College has been working with Dr. Foster since about 2002. We've been processing the very rich data, particularly on hospital admissions and more recently on GP practices. And we do this to do several things. One is to measure the quality and safety of care. Another thing we do is to develop so-called risk prediction models. We also help and validate the models that Dr. Foster analysts build for risk prediction, or for making fairer comparisons between hospitals and between surgeons, to give the NHS better information on how it's performing and how to use its resources better.
We have a system at the moment which is very reactive, so patients get sick or they have a fall or such like, and they end up in hospital, and these are avoidable events, and if patients are managed proactively, they can be avoided.
And there's a lot of data collected in different sources these days, both things like sensors, like your continuous glucose monitor, to apps on your phone that help you manage your diet and think about counting carbohydrates, etc. As they're doing in northwest London, where we're based here, they've got a plan in place to try and put all this data together and really make the use of it to help people manage their long-term conditions, which is a really worthwhile and important thing to do.